You feel exhausted every day, no matter how much sleep you get. Some mornings you wake up with a headache or sore throat. Your partner complains about you snoring. You've noticed yourself nodding off during the day, even if you've had a full night's rest. Unfortunately, these could be signs of sleep apnea, a condition where breathing repeatedly stops and starts during sleep. If you have polycystic ovarian syndrome or PCOS, you're more likely to have sleep apnea, even if your weight is normal. Up to 35% of women with PCOS have the sleep disorder. The interrupted breathing deprives your brain and body of enough oxygen, leaving you feeling fatigued. Sleep apnea increases your risk of high blood pressure, heart disease, and type 2 diabetes. If this sounds familiar, talk to your doctor. An overnight sleep study can diagnose sleep apnea, and treatments like CPAP machines can help you finally get the restorative sleep you need. As a woman with PCOS, there's a good chance you could be suffering from obstructive sleep apnea, especially if you often find yourself feeling excessively tired during the day despite sleeping for 7 to 8 hours a night. Studies show obstructive sleep apnea affects up to 35% of women with PCOS compared to only 5% of women without PCOS. The hormonal imbalances common in PCOS, especially higher testosterone levels and insulin resistance, are thought to play a role in the development of obstructive sleep apnea. Excess fat around the neck can also increase your risk. So let's talk about the common symptoms of obstructive sleep apnea. And these include loud snoring or gasping for air during sleep, waking up feeling unrefreshed even after a full night's sleep, difficulty concentrating or mood changes due to daytime sleepiness, and morning headaches. If you experience these symptoms, talk to your doctor about being evaluated for obstructive sleep apnea. They may refer you for an overnight sleep study to monitor your breathing, heart rate, and sleep stages. Treatment options for obstructive sleep apnea include lifestyle changes, oral appliances, and CPAP therapy. Getting diagnosed and following the recommended treatment can significantly improve your quality of life and health. Obstructive sleep apnea left untreated is associated with risks like high blood pressure, heart disease, and type 2 diabetes, all of which women with PCOS are already prone to. Don't resign yourself to constant fatigue and poor health. Talk to your doctor if you suspect you may have sleep apnea. There are many effective options available to help you sleep better, boost your energy levels, and support your long-term health and well-being. You deserve to feel your best, little lady. So now I want to go into each symptom of obstructive sleep apnea more in depth so that you know what to look for as a woman with PCOS. If you find yourself waking up exhausted, even after getting 8 hours of sleep, you can have obstructive sleep apnea. The sleep disorder causes your breathing to stop and start repeatedly during the night, preventing you from getting the restorative sleep you need. Women with PCOS have a higher risk of obstructive sleep apnea, so it's important to be aware of the signs. The most common symptom is loud snoring. If your snoring is frequent and loud enough to wake up yourself or your partner, that's a red flag for obstructive sleep apnea. The snoring occurs when air flows past relaxed tissues in your throat during sleep. Do you ever wake up suddenly feeling short of breath or gasping for air? This can happen when your airway becomes completely blocked during sleep and your body reacts to restore breathing. These frightening episodes are a symptom you shouldn't ignore. Feeling drowsy and fatigued during the day, even after getting enough sleep, is a hallmark sign of obstructive sleep apnea. When your sleep is disrupted throughout the night, you can't reach the deeper stages of sleep needed to feel rested. This daytime sleepiness can interfere with work or social activities and reduce your quality of life. Waking up with dull headaches that fade as the day goes on can also indicate obstructive sleep apnea. The headaches result from oxygen deprivation during the night combined with changes in blood flow. While occasional morning headaches are normal, frequent or intense headaches require medical evaluation. If any of these symptoms sound familiar, talk to your doctor. An overnight sleep study can diagnose obstructive sleep apnea, and treatment like a CPAP machine can help you get the restorative sleep you've been missing. So sweet dreams. All right, so if you've been diagnosed with obstructive sleep apnea and PCOS, the good news is there are several lifestyle changes and treatment options that can help improve your symptoms. So now I want to talk about lifestyle changes and treatment options for obstructive sleep apnea in women with PCOS. So the first one is to lose excess weight. Losing weight is one of the best ways to reduce sleep apnea episodes. Excess fat around the neck can put pressure on your airway during sleep. So you want to aim for a 5 to 10% weight loss, which can significantly decrease apnea events. To do this, you want to focus on a balanced diet with lean proteins, high fiber, whole grains, fruits and vegetables, and limit processed foods, sugar, and red meat. Increasing exercise will also help with weight loss and improve sleep quality. If you're struggling with eating a healthy diet and change your lifestyle habits, I have an online nutrition course that has helped many of my PCOS sisters. It has video lessons, handouts, and so much more so that you can lose weight, reduce androgen hormones, start ovulating again, and feel so much better without cutting calories and giving up your favorite foods. The link is in the description box below if you want to check it out. The next lifestyle change on my list is to practice good sleep hygiene. Establishing a relaxing bedtime routine can help you sleep better at night. Limit screen time, caffeine, and heavy meals before bed. Make sure your bedroom is cool, dark, and quiet, and go to bed and wake up at the same time each day. These simple changes can make a big difference in your sleep quality and daytime alertness. The next one on my list is oral appliance therapy. An oral appliance that fits over your teeth can help move your jaw forward to open up your airway during sleep. These dental devices tend to be more comfortable than CPAP machines for some people. However, they may cause changes in your bite or jaw pain. You'll need to see a dentist experienced in oral appliance therapy to be fitted for a device. And the last treatment option on my list is surgery. For severe obstructive sleep apnea, surgery may be recommended as a treatment option. Procedures like uvulopalatopharyngoplasty, which is abbreviated as UPPP, remove excess tissue in the throat to open up the airway. More invasive surgeries may be needed in some cases. Surgery does carry risk, of course, so you'll want to discuss the pros and cons with your doctor to determine if it's the right choice for you based on the severity of your condition and health history. With the right treatment plan, including lifestyle changes and medical therapies tailored to your needs, you can find relief from the symptoms of obstructive sleep apnea and PCOS. Be patient through the process as it can take time to determine the optimal solutions for your situation. But with commitment to better health, you'll be sleeping and feeling better in no time. So in summary, if you have PCOS and are constantly exhausted even after getting enough sleep, it could be a sign of sleep apnea. Pay attention to other symptoms like snoring, morning headaches, and feeling unrested after a full night's sleep. Don't brush it off. Talk to your doctor about getting tested for sleep apnea. Treating it could give you the energy boost you've been looking for, along with improving your quality of sleep. With the right lifestyle changes and treatment, you can start feeling refreshed and energized again. My name is Teresa. I'm a registered dietitian, nutritionist, and a health coach, and I enjoy posting videos about PCOS because it is something that I struggled with for many years. I was able to reverse my PCOS with diet and lifestyle changes, and now my period is completely irregular and I ovulate every month. My skin cleared up as well, and I don't get cysts on my ovaries anymore. Subscribe if you want to stay connected with me and see any new videos I post on nutrition to learn how you can achieve your health and wellness goals for muscle gain and weight loss. And if you're a woman dealing with fertility issues, I also specialize in PCOS, endometriosis, and skin issues like acne. Thank you so much for watching, and I'll see you in my next video.